I wish I had known this earlier. Maybe my mother wouldn't have had to spend the last 3 years of her life in a hospital bed, unable to walk, unable to speak. That was the message I received from someone just like you, someone searching for answers a little too late. Out of all the health challenges a person can face, few hit harder or faster than a stroke. It's sudden, it's cruel, and it doesn't give you time to prepare. One moment, you're living life. The next, you're fighting to speak, fighting to move, fighting to remember the name of your own child. And the truth? Most people don't realize how fragile the brain becomes in those first minutes. How one tiny clot, one small rupture, can erase decades of memories, independence, even personality. But here's the thing. What if you had just a little more time? What if someone had told you about the signs to look for, the one nutrient that could protect your brain, and the habits that could keep you from ever having a stroke in the first place? Because when it comes to stroke, the difference between a full recovery and no recovery at all often comes down to one thing: knowledge. Not luck, not age, not genetics. So before we go any further, I want to ask you something. Do you have someone in your life, maybe a spouse, a brother, a neighbor, who's had a small stroke and just brushed it off? Or maybe it happened to you, because this video might be the wake-up call they've been waiting for. And if you're over 60, listen closely. This isn't just a health talk. This could be a life-saving moment. 15 minutes, that's all it takes. 15 minutes between catching it in time or losing the ability to walk, talk, or even recognize your own family. You see, the brain doesn't wait. Once a stroke begins, it's like a fire spreading room to room. And unless you act fast, those rooms start shutting down, one by one. That's why what you do in the first 15 minutes could define the rest of your life. But how many of us would recognize the signs? Would you? There's something many people misunderstand, and it's dangerous. They hear the phrase mini stroke and think it's no big deal. Maybe they had a moment of blurred vision, a little dizziness, or their speech slurred just for a few seconds. Then everything returned to normal. They feel fine, so they go on with their day. But here's the truth. A mini stroke, or TIA, transient ischemic attack, is your body's warning shot. It's the brain's way of saying, next time, I may not let you walk away. A mini stroke is caused by a brief blockage of blood flow to the brain. It lasts anywhere from a few minutes to about 24 hours. And yes, the symptoms vanish. But that doesn't mean the threat is gone. In fact, 1 in 5 people who experience a mini stroke will have a full-blown stroke within the next year. That's not speculation. That's data. And when that severe stroke hits, it doesn't always leave quietly. It can cause permanent damage, paralysis on one side of the body, memory loss, speech loss, even loss of independence. You may walk into a hospital and never walk out again. So let me ask, if you or someone you love had signs of a mini stroke, would you recognize how urgent that moment really is? Would you act? Because a mini stroke is not a mild event. It's a loud, flashing red light, one that tells you, change something now. Don't wait. It might be your only warning. So how do you know when it's happening? How do you spot the moment when seconds matter most? There's a simple way to remember the warning signs of a stroke. It's an acronym every person over 60 should memorize today. BFAST. B is for balance. If you suddenly feel dizzy, off balance, or unsteady on your feet, that's not just fatigue. It could be a stroke. E stands for eyes. Blurred or double vision in one or both eyes, or a sudden loss of vision, like a curtain dropping over part of your sight. F means face. Ask the person to smile. If one side droops, even slightly, that's a sign of facial muscle weakness. A is for arms. Raise both arms. If one drifts downward or doesn't respond at all, Something's wrong. S stands for speech, slurred words, incoherent sentences, or even an odd pause when they try to say something simple like their name. T is for time, because time lost is brain lost. If you see any of these signs, even just one, call 911 immediately. Now here's something many don't realize. These symptoms can appear mildly for just a few minutes. They may disappear, but that doesn't mean it's over. Other early signs people have reported include walking to the side or backwards without realizing it, a strange electrical tingle through the mouth or face, sudden confusion or difficulty understanding speech, a crooked tongue when asked to stick it out. Some have even said it felt like something was off, but couldn't explain what. And later, a scan confirmed it. A stroke had already happened. So don't second guess your gut. If something feels wrong, be fast. Your brain will thank you. You've probably heard of vitamin E. Maybe your doctor mentioned it. Maybe you saw it on a supplement label once or twice. But what if I told you there's a form of vitamin E that's 1,000 times more powerful at protecting your brain? And almost no one talks about it. Not your average drugstore version. Not the kind most multivitamins use. This one has the ability to guard your brain cells during a stroke, support healing afterward, and even reduce your future risk. And chances are, it's missing from your cabinet right now. Most people think all vitamin E is the same, but that's not true. Vitamin E actually comes in 8 different forms, divided into 2 main groups, tocopherols and tocotrienols. What you find in most supplements. That's alpha tocopherol, the standard, widely used version. But here's the shocker. Alpha tocotrienol, a lesser-known cousin, is vastly more effective, especially when it comes to brain health. According to a groundbreaking study published in Stroke, alpha tocotrienol was shown to be 1,000 times more potent than alpha tocopherol in protecting nerve cells from damage during a stroke. That's not marketing hype. That's a peer-reviewed clinical fact. So what makes tocotrienol so powerful? It starts at the cellular level. When a stroke happens, especially an ischemic one, your brain is starved of oxygen. Neurons begin to die rapidly. But tocotrienols have a unique ability to neutralize free radicals that damage brain tissue, reduce inflammation in critical brain regions, block destructive enzymes like CEC kinase, which attack nerve cells during oxygen deprivation, promote blood flow, improving oxygen delivery where it's needed most. Even more remarkable, tocotrienols activate a transporter protein called MRP1, which helps flush out oxidized glutathione, a toxic byproduct that builds up during stroke and leads to further neural damage. This is in theory. In animal models, researchers saw dramatically smaller brain lesions and better neurological function in subjects given tocotrienol, even after the stroke had already started. And it's not just about prevention. Studies show tocotrienols can shield neurons during the stroke itself, support regeneration in the days and weeks that follow, improve long-term memory and motor recovery. But here's the problem. Most vitamin E products only contain tocopherol, and worse, alpha tocopherol can actually block the absorption of tocotrienols in your body. That's why it's critical to choose a tocotrienol supplement that contains all 4 types, alpha, beta, gamma, and delta, is labeled as tocotrienol-rich fraction or annatto-sourced, has no added tocopherol. This small shift, knowing the right form of vitamin E, can be life-changing. Instead of taking the common road with little effect, you take the smarter path that leads to real protection and recovery. Now that you know what tocotrienols can do, the next question is, how do you use them the right way? Because this is where many people, even the well-intentioned ones, go wrong. They buy the wrong form, they take the wrong dose, or worse, they combine it with things that cancel out its benefits entirely. So let's break it down clearly. First, you need a pure tocotrienol supplement, not one mixed with tocopherol. As strange as it sounds, alpha tocopherol, the standard vitamin E in most bottles, actually competes with tocotrienols for absorption. That means if you take both at the same time, you may not get any benefit at all from the tocotrienols. Always check the label. It should say tocotrienol-rich fraction or delta and gamma tocotrienol, sourced from annatto, rice bran, or palm oil, free of alpha tocopherol unless specifically timed separately. Second, timing and dosage matter. For prevention, a common recommendation is around 100-200 milliliters per day, depending on the brand. But for recovery after a stroke, or if you're at high risk, researchers have used up to 400-600 ml per day, split into 2 or 3 doses throughout the day. And remember, tocotrienols are fat-soluble, so always take them with food that contains healthy fat, like olive oil, nuts, or avocado, for proper absorption. Third, don't expect miracles if your lifestyle is still working against you. Tocotrienols can't protect your brain if you're still eating inflammatory foods, ignoring blood sugar issues, or sitting sedentary all day. They're powerful, yes, but they're not magic. And lastly, here's something important no one tells you. Do not wait for the next stroke to start taking them. Many viewers have shared stories of buying tocotrienols only after a second or third event. But imagine how much damage could have been prevented if they had started earlier. Instead of waiting for doctors to act or for symptoms to return, you take action now. You choose to protect your brain proactively, because the earlier you support your neurons, the better chance they have to survive, recover, and keep you living independently. You can take the best supplement in the world, but if your diet is still working against you, it's like trying to put out a fire while pouring gasoline on it. That's the hard truth. Tocotrienols help, but they can't undo damage caused by sugar, processed oils, and chronic inflammation. So if you're serious about preventing another stroke or avoiding your first one, what you put on your plate matters just as much as what you put in your supplement drawer. Because healing isn't just about adding, it's about removing the real threats too. After a stroke, especially a mild one, it's easy to fall into a false sense of security. You recover a bit, the speech improves, the arm moves again. Life feels almost normal, but here's the danger. Most second strokes are more damaging than the first, and in many cases, they're preventable. Let's talk about 5 common mistakes that silently open the door to another stroke. 1. Relying only on aspirin without knowing your stroke type. Aspirin may help thin the blood in ischemic strokes, but if your stroke was hemorrhagic, a burst vessel, it can make things worse. Some patients were given aspirin before doctors ruled out bleeding, only to suffer internal complications. Always confirm your stroke type before relying on medications like aspirin. 2. Eating inflammatory fats. Vegetable oils like soybean, canola, corn, safflower, and sunflower are rich in omega-6 fatty acids. These promote chronic inflammation in the blood vessels, prime conditions for another clot. Instead, use olive oil, avocado oil, or small amounts of coconut oil. 3. High sugar intake, even healthy sugar. Sugar spikes insulin and damages arterial walls over time. That includes fruit juices, energy bars, and low-fat snacks. You can't out-supplement a bad insulin response. 4. No movement. After stroke, fear or fatigue may lead to inactivity, but movement, even small, consistent effort, improves circulation, brain oxygenation, and recovery. Sitting still is a slow road to decline. 5. Ignoring blood pressure swings. Fluctuating or uncontrolled blood pressure is a ticking time bomb. Stroke survivors must monitor regularly and address the root causes, not just cover symptoms. Because in the end, Avoiding that second stroke isn't about luck. It's about not repeating what put you at risk the first time. After the hospital stay, after the physical therapy begins, many stroke survivors ask the same question. What else can I do to heal? The truth is, the brain has an incredible capacity to recover, but only if we give it the tools it needs. Let's talk about a few natural methods that can dramatically support stroke recovery, especially when combined with medical care. 1. Acupuncture within the first 30 days. One woman shared how her 80-year-old mother, completely paralyzed on one side, began acupuncture on day 29 after a stroke. By her third session, she was walking again, fully independent. Clinical studies now show that acupuncture can improve neuroplasticity and blood flow, especially when started within the first month. 2. Crushed garlic for blood thinning and pressure control. Garlic isn't just a seasoning, it's a vasodilator. Raw, freshly crushed garlic releases allicin, a compound that naturally lowers blood pressure and improves circulation. Some viewers reported a 10 to 20-point drop in blood pressure after consistent use. Skip the dried pills. Use real garlic, crushed and eaten within 15 minutes. 3. Cayenne pepper for emergency support. There are anecdotes of cayenne pepper, mixed in warm water, helping stroke victims regain consciousness while waiting for emergency care. While not a replacement for medical treatment, its ability to stimulate blood flow has caught the attention of holistic practitioners. Some even compare it to natural nitroglycerin. 4. Ketogenic diet to heal from the inside. The keto diet helps stabilize insulin, reduce inflammation, and provide the brain with ketones, an alternative fuel that supports recovery. Several stroke survivors in their 60s and 70s say keto gave them mental clarity and steady energy during rehab. 5. Vitamin B1, thiamine, especially in benfotiamine form. Thiamine is essential for nerve repair and cognitive function. Deficiencies are common in older adults and can mimic stroke symptoms. Supplementing with B1 alongside tocotrienols can accelerate recovery, especially in cases with fatigue or brain fog. Recovery isn't a straight road, but every effort matters. And when natural tools are combined with medical wisdom, the healing process becomes something far more powerful than we've been told. Because life after stroke doesn't just have to be survival, it can be revival. If there's one thing I hope you take away from this, it's this. A stroke is not the end of the story, but it can be the turning point. Too many people wait. They wait for a second warning. They wait until speech is lost, memory slips, or the hand won't rise anymore. But you don't have to wait. Maybe it's adding one new habit, crushing garlic with dinner, or swapping out your old cooking oil, or finally taking that walk after lunch, even if it's just around the block. Maybe it's simply learning the word tocotrienol and giving your brain the nutrient it's been missing all these years. Small decisions, quiet changes, but they stack up. They build something powerful, a second chance. And whether you're recovering from a stroke or trying to prevent your first, remember this. It's not too late. Your body's still listening. Your brain is still fighting for you. And sometimes all it needs is for you to fight with it. Now's the moment to act. If this video spoke to you, if you saw yourself or someone you love in any part of this, don't just click away. Save this video, share it with a friend, a sibling, a parent, someone recovering, someone unaware, someone who needs it. Because knowledge delayed is recovery denied. And if you're over 60 or you care for someone who is, start with just one thing today. One step, one change, one decision to protect your brain and reclaim your life. You still have time. Make it count.